Good afternoon, everyone, and welcome to our Community and Health Services Committee meeting for December the 5th. As part of our agenda today, our healthcare system partners will provide us with an update on alternate destination clinics. And before we begin with the number of questions that might be anticipated, I want to remind committee that to ensure that we can hear from everyone, we'll continue with one question and one follow-up. And then if you have more questions, we'll add you to the back of the queue. Also, a reminder that all of our votes are recorded on eScribe, so try and be in your system as we proceed. And I'll call on Will Short to do the roll call.
Thank you, Chair. Chair Redmond.
Present.
Councillor Craig. Present. Councillor Deutschman.
Present.
Councillor Erb. Chair
Present.
Erb. Councillor Foxton.
Present.
Councillor Harris. Councillor Hunig.
Present.
Councillor James.
Present.
Councillor Liggett.
Present.
Councillor McCabe.
Present.
Councillor Solonen. Councillor Verbanovic. Councillor Williams.
Here.
Councillor Wolf.
Present.
And regrets from Councillor Nowak. Thank you, Chair.
Thank you.
Oh, Councillor Shantz, she's here too. Thank you.
As we begin this meeting, we are again reminded that many of our homes and places of employment in Waterloo region are situated on the land that is the traditional territory of the Haudenosaunee, Anishinaabe, and Chataton peoples. We recognize and deeply appreciate their historic connection to Waterloo region, and we also recognize the contributions Indigenous peoples have made in shaping and strengthening this community. We are grateful for the opportunity to live and work here and reaffirm our collective commitment to keep the promise and the challenge of truth and reconciliation alive and intentional in our region. Are there any members of council that have a pecuniary interest under the Municipal Conflict of Interest Act? None? Before we hear from our delegation, I'd like to remind my colleagues that questions are to be directed to the delegations, and staff will be speaking about these matters later in the agenda. We have one delegation, and I'd like to remind the delegation of some guidelines for participation. If you conduct yourself in any of the following manners, it will result in an immediate removal from the meeting: interrupting councillors, staff, or other delegations, derogatory statements about councillors, staff, or others, turning your camera on at inappropriate times, and hate speech or defamatory comments. And just one last reminder to delegations, please don't take offense if following your presentation there are no questions from council. This is council's time to really listen and reflect upon the opinions and ideas that you share with us as community members. And our first delegation, and only delegation that's recorded, is Camille Hamad. Going to come to the podium, please. And because you've registered, you have 5 minutes to speak.
Thanks. Thank you. Afternoon, councillors, Madam Chair. Thank you for the time today and the lovely staff over email who helped make it happen. My name is Kamal, and I'm here in between community work to invite your consideration for an investment in social transformation, the real kind. I'm speaking directly to the bylaw amendment council passed in September to curb hate in our community. I understand you folks are in a critical time before the bylaw comes into effect in January, and I thought, as you work on your implementation and training plans, it was now or never for me to pitch restorative justice and its deployment in the face of hate and harm on regional property. At the September 27th meeting, I sat back there as you heard reasons why the bylaw was a good idea and reasons why it wasn't. And I realized you hadn't heard any delegations about how you might do it well and set precedent for excellence in justice reform across Canada. I get to work at Community Justice Initiatives, a local restorative justice agency that you may have heard of in its 40-year history here. Have you met restorative justice? Well, let me take you through a really quick first date. In short, it's both a philosophy and a practice, an alternative framework for thinking about wrongdoing realized through a myriad of approaches for facilitating deep understanding and unlearning, fostering authentic accountability, and engaging peace and healing. I get to coordinate a very specialized service at CGI that offers restorative justice approaches in instances of identity-based harm, situations where someone's identity or aspects of it were the target of harm. We're talking about instances of racism, anti-Semitism, xenophobia, Islamophobia, queer and transphobia, and the list goes on. On a day-to-day basis, I work with those that have caused identity-based harm as well as those that have experienced it in our community to co-create a victim-centered and needs-driven dialogue process that enables exchange and empowers transformation. We already receive cases where police charges have been laid from Waterloo Regional Police Services and the Crown Prosecutor's Office, as well as cases and requests for support directly from community. Incidents in schools, workplaces, community centers, you get it. It's not always an appropriate or desired response, but where it is both those things, folks harmed are supported to share the impact an experience had on them, ask questions they need answers to, and assert needs around accountability. Those that have caused harm are supported to understand their actions, receive the impact of those actions, and develop and communicate accountability. We do this work because we know as deeply as we can that punitive approaches will not and do not deter or transform harmful beliefs. And in my experience as a queer Muslim immigrant from Pakistan, I can tell you it usually makes things worse. Prohibiting behavior that we don't accept and isn't welcome has merit if we think that the act of prohibiting will stop it. But I think you know that that's unlikely here. We as practitioners know that while all instances of identity-based harm can have impact and cause deep wounds, we also know that most instances of identity-based harm in our community, such as the ones bylaw will begin responding to, are often the result of toxic and skewed perceptions compounded by projected pain, not a radicalization to violence. I wish I had time to share the countless stories I want to tell you, but all I'll say is hurt people hurt people. And when hurt people who are hurting people feel like something else is being taken away from them, like their voice, they usually dig their heels in deeper. I'm not justifying that behavior or asking you to align with its explanation. I'm simply asking you to believe that this is what happens. I've worked with both young people and adults whose harmful rhetoric was silenced or punished in one arena, like a classroom or grocery store, only to rear an uglier, more venomous head in another space, like online, or upon confrontation of someone that might look similar in the bathroom of a Timmy's or on a walk home at night. In a climate of cancel culture as our best collective attempt at justice, I've seen the role phones and cameras play in escalation. In the rightful and noble pursuit to capture proof of incident for bylaw officers, those who are experiencing harm will witness those causing harm react to the fear of what this moment of meltdown could mean for their livelihood and family. The cycle of harm continues to flow until you break that cycle. To my regional council, who and what are we looking to protect? If we want to really protect community, and by really protect, I mean invest in prevention, not just in reacting to harm that happens in a very small number of places as the bylaw as is intends to, then we need to invite people in instead of pushing them out. This is the harder work, the slower and more transformative work, and I implore you to join us in it. In case it isn't clear, I'm not asking you to do anything but invest in your formal implementation plan for this bylaw amendment. Take this community safety measure you've already built to the next level. Go beyond just reacting to harm and into addressing it, calling it in, inviting it to unearth itself, to witness who it has harmed, hear their needs, and in doing so, get closer to preventing it from happening again. That's accountability and justice.
I'm sorry to interrupt. Your time is up, so I'm wondering if you're able to.
I have one more sentence, if that's okay.
Thank you.
I implore you to consider embedding restorative options in the response of this bylaw amendment, leverage CGI's work, invest in community work, and model real progress. I invite you to ask me questions to build clarity and feel informed so you can discuss this amongst yourselves. Thank you so much.
Thank you. And if you want to remain at the podium, we do have a couple of questions.
Awesome.
Councillor Deutschman.
Yeah, hi. Good afternoon, Camille. Thank you for coming in. Speaking about the next steps, I always feel it's very important that we have to think about when we introduce something, how are we implementing and acting on it. I have met with Jason from Community Justice Initiatives and Sarah Escobar on a couple of occasions. And I'm very impressed with that organization. And the region, I believe, provides funding, some funding towards that organization. So we're very familiar with CJI. But my question then to you would be, how would you see CGI becoming involved? Like, how would you envision that next step where there's an act a ticket or something or whatever is provided, then what's the next step as you envision it?
Yeah, thank you. Thank you, Councillor Deutschman. Appreciate the engagement. So, I mean, we would, if there was interest in collaborating with community justice initiatives, we would certainly co-create a framework and approach that would feel good for bylaw, that would feel good for you, and would feel good for community members. For the sake of conversation right now, I can say that we would model it after what already exists. And so, like I mentioned, Waterloo Regional Police Services, Crown Attorneys, even at times, bylaw have made referrals to community justice initiatives, and more specifically, that program I get to coordinate for identity-based harm. And so that can follow precedent that already exists where, you know, whether a criminal charge is laid or a ticket is issued, and then individuals are offered the choice of engaging in a restorative process, which would trigger a referral to our program area. You know, one of the tenets of restorative justice is that it's voluntary and it's a choice. I'm not asking you to say that if you complete this program, it means that you won't have any punitive repercussions or consequences. It is not a request for a full withdrawal or diversion. It is a request for conjunction or partnership with a bylaw enactment so that there's real opportunity for transformation and learning. So I would say we'd co-create it, but we can also model it after what already exists as a referral pathway.
Yeah, thank you for that. My understanding was CGI originated out of this concept of it might have been some youth who caused some harm to someone, and then it was an apology or acknowledgement of what the implications of their acts were. I have some questions for staff after the delegation, but thank you, Camille, for that answer.
Thank you, Councillor.
Councillor James?
Hi, thank you through you, Chair Erb. Thanks for coming in, Kamel, and for the work you're doing. I just have a couple of questions for clarification because I know Councillor Deutschman alluded to this. I spoke earlier about this. I know the region provides some form of resources to CJI. How does that work with the restorative justice piece? Because I feel like you're asking us to participate or for you to help with the bylaw, but if we're already supporting, isn't that already happening in some capacity? I just want clarification around that.
Yeah, great question, Councillor. Thank you for asking that. So the funding that I believe you're speaking of is funding that was allocated for the Community Justice Center as a revival or a continuation of what the Crime Prevention Council was working on. And that is in an intentional effort to move restorative approaches upstream. We're talking about upstream approaches, so that's happening through our housing portfolio, our youth engagement portfolio, as well as some other pieces. That's what Councillor Deutschman has connected with Jason and Sarah about. This piece is downstream work. It's reactive work. While it has the intentions of creating prevention, it's not working upstream directly. And so that funding from the region was never intended to or allocated for downstream responses to harm in our community. That program area that I currently run off the side of my desk has no funding besides grant funding that we continue to apply to maintain my position and the position of others on our team. So they could work in conjunction, and at the same time would certainly not want to take away from commitments that have been made by the region and CGI for a very specific portfolio of work that this could fall pieces of this work could fall into that, but it would not be enough or sufficient.
Okay, and I think part of the funding and investment, and this may be going back to staff, just some clarity around that, because I think if there's opportunities potentially to reassign resources, that's something that maybe should be explored, but I'll leave that to staff. Okay, thank you.
Thank you.
Councillor Hunick?
Through you, Chair, and thank you, Kamal, for your excellent delegation and the work that you do in our community.
Thank
It's
you.
awesome. I'm just wondering, for those of us who are less familiar with restorative justice options or opportunities, can you speak a little bit more about what that might look like?
Yeah, so at its core, restorative justice, as I briefly teased out, is a framework for approaching wrongdoing and harm slightly differently, significantly differently than the criminal legal system. It believes that punitive approaches to wrongdoing do not actually eliminate or transform that behavior. in most cases, especially in vulnerable cases where identity-based harm has happened, it further entrenches those beliefs and positions as opposed to inviting them to evolve. And so restorative justice can look like a variety of approaches, but for the sake of this conversation, in response to a bylaw violation of identity-based harm, it could be an opportunity for dialogue. And so that can look like a lot of different things, but in its most traditional, its most simplest form, it can look like a dialogue opportunity between someone who's caused harm and someone who's experienced harm. It's certainly not always appropriate or desired, but where it is both those things, that can mean a supported mediation, where these parties are supported individually to come together to have a conversation that's supported by facilitators, to have an exchange of the impact of those actions, why it is impactful in the first place, and to explore what accountability would feel like in a meaningful way. It also doesn't have to look like a face-to-face dialogue. It can look like letter writing. It can also look like shuttle mediations where restorative justice practitioners move between places where these individuals are held to exchange information. It can also look like circle processes that we've been taught by Indigenous elders that have an intentional space for the witnessing of voices without there being room for debate. It can look like a lot of different things, but at its core, it's trying to solve for real transformation, real exchange, and real accountability, as opposed to punishing wrongdoing that either hides it for a later point or actually entrenches the positions deeper as people feel like something is being taken away from them, or it feels like we are taking sides. I hope that's helpful.
Yes, it is. Thank you very much for the excellent summary.
Thank you.
Chair Redmond?
Thank you, Chair Erb. Thank you very much for coming in and for offering solutions. I do have a question of staff too, but of the delegation, this is an update of our anti-harassment bylaw. Do you know what our current repercussion is for being infraction of our anti-harassment bylaw?
Current or upon January 2024?
I'm sorry?
As of right now or as of January 2024?
As of right now.
I believe that right now it would be an ask to step away from regional property. Is that correct? Perhaps coupled with a fine in certain situations?
Okay, I actually don't know. I was wondering if you did. So the question I would have of staff is there must be an implementation plan.
Certainly.
I'd be interested to hear from them, but thank you very much for coming in and offering a solution.
Thank you, Chair Redmond.
Round two, Councillor Deutschman.
Yeah, thank you. I was sort of just following up on Chair Redmond. Camille, I didn't really have a question for you other than when I did speak with CJI, they had mentioned that because there was funding from the region already, and my discussions were that with them, with Jason and Sarah, were in the context of the King Street shelter, because we had talked about it and they had suggested that there might be an opportunity for them to, CGI, to become involved in dealing with the neighborhood issues that were going on out there because of the overall frustration from neighbors not feeling they were being heard. And I did connect Jason with Mr. Mancini from the Working Center. So my question now is more towards staff. I'm interested to know when we've implemented this change in our bylaw, what is the next step? And is there an opportunity to review and see if we can consider something like what Camille is talking about to us today as a diversion program or something to consider the next step. And I guess sometimes it's like we have these policies, these bylaws, and there's potential fines or whatever ticketing or what have you is for infractions. But what goes on? It's not like and we're not talking like a speeding ticket here or something like that. This is obviously a different situation with different implications. So I'm more directed towards, I'd like to hear from staff on what currently happens as of January 2024, as you mentioned, Camille, about.
Okay, I think staff are prepared to answer, but I'm wondering, do we have any more questions from council members to the delegation first? Okay, so Mr. Lochner?
Sure, I can start, and Graham may want to jump in. I think there were a few questions there. So really appreciate Camille coming in today, and I think that's something that we want to take away. One of the questions that I need to follow up with staff on is how many circumstances do we find ourselves in with all our buildings where we run across a particular circumstance that might benefit from the type of solution that the delegation is putting forward, and how many are circumstances that may involve some other type of approach as outlined in the bylaw. So I think if we could take that away and then come back to council with a more definitive plan, I think it's been a great presentation to allow us to think about different options around bylaws. And certainly there isn't one solution that any of our bylaw officers or anyone else from the enforcement perspective would take. That it's one approach for everyone or one approach to each circumstance. So if we could take that away and then come back to council, that would be great.
So Chair, I'd be prepared to do that as a direction to staff if that's acceptable to all of council.
I don't see any objections. No. Did you want to add something to it, Mr. Walsh?
Certainly through you, Mr. Chair. So what I can just say is that the staff from our enforcement legal are ready. Reconciliation, equity, diversity, inclusion teams developed a training package for staff that will be responsible for enforcing this bylaw as of January 1st. And we have had training sessions with staff. And I would say that some of the ideas that were discussed today are things that we have already discussed in the training package that was delivered. There's an email going to council to update council on this. We're always happy to hear more and look into more options, but I can say that education as a key tool or as a key benefit of this legislative change was a big factor discussed, that there's an informative and an educational value to the bylaw amendment that will translate into how it's enforced.
Councillor McCabe. Sorry.
Yeah, thank you. I was actually just trying to remove my name because I was going to ask that question. So, but thank you very much for anticipating that.
Any other questions? Councillor Foxton.
Thank you. And I think we've done some pretty good work here. My concern is that it's regional property only. And I wonder if we have to talk to all 7 municipalities plus the region and say, this has to be consistent across the board so that it's not allowed anywhere in Waterloo region. And it has to be enforced across the board by everyone. And so if I was to say anything, I would ask that a motion go out, that Region of Waterloo request every municipality to stand against this type of activity and to enforce safety for all.
I would second that.
Who was the seconder?
Chair, it may be asked that I'm asking that it be a motion to come forward at the next time because I haven't put it in advance. That would be fine. I'm fine with that. Everybody's fine with that? Yeah.
Yeah, we're not quite clear on the intent right now, so that would be helpful. Okay, just for curiosity, are you here representing community justice initiatives, or is this an initiative on your own? Just for for the help of the council or committee.
Yeah, thank you for asking. I don't know if it's the mic that's working or I'm using my projection, but either way, I hope you can hear me. Yeah, I'm representing Community Justice Initiatives that offers this program and works in partnership with law enforcement for formal referral pathways, so certainly not something that I'm offering as an individual. It would also be backed up. The program area exists with a variety of volunteers and staff members across community that have been trained in restorative justice and specifically trauma-informed approaches to restorative justice for identity-based harm to facilitate those restorative processes. So as much as, you know, we love working with bylaw, we love working with police, we recognize that there is a bit of a distinction in how this work is approached. And really what's on the table here is not a specific ask, but as many of you have addressed, it's a conversation about how this can be an option as part of the response to this bylaw. And so there may be some training aspects that we can offer to bylaw or staff. There can also be some capacity building options for regional properties where staff do exist to be able to de-escalate a situation as opposed to escalate it. And then there can also be the service of facilitating those dialogues itself. So there's a variety of ways that you can lean into restorative justice and leverage our work at CJI formally.
Thank you.
Thank you.
Thank you for attending.
Thank you for having me. Take care out here. Good luck.
Thank you. We are on number 6, the consent agenda. If you wish to remove an item from the Councillor James, apologies, I didn't see your name.
Well, I just in response to Councillor Foxton, I just wanted to note that, like at the City of Waterloo, we're already working on an anti-hate bylaw that will work in parallel with the regional one. So I kind of assumed that other municipalities were doing that. So I don't know that a motion, I'm not opposed to a motion, but just wanted to let you know that we are deep into that work already and should have something early January. So leave it to our other colleagues. If you want to pass a motion, that's fine, but we're working on it already. Just want to share that.
Councillor James?
Yeah, through you, Chair. Just, I'm a little bit confused just in terms of we've got an agreement with an organization for a set amount of funding, and now we've got the same organization that is coming asking for to partner with our bylaw, our anti-hate bylaw. So, I mean, I really want some clarity from staff around this with regards to my ask earlier, because there's a significant amount of money being invested, and if there's, my understanding is that there would be communication between the two between us and the organization anyway. So, I'm baffled right now. Bruce, you want to speak to that?
Mr. Lochner?
Yes, Chair. Hopefully this clarifies and doesn't add more confusion. My understanding of Councillor James's motion is related to the outcomes that are specific to the $500,000+ we provide to CGI as an organization. So CGI is a fairly large organization. One of the funding streams we provide to them, this council took a decision about a year and a half ago, if I recall, for the creation of a justice center, which is separate from their other work. On a regular basis, they do restorative justice work as one of many streams. And I believe the delegation was speaking more broadly to the restorative justice work that they do, separate from the justice centers itself. So we will report back on the dedicated funding that this council provided to CGI on the creation of a new justice center. We will also follow up with CGI. We have a good partnership with them on where restorative justice principles may be applied. And I heard from council, could they be applied to the instance of the bylaw? Could they be applied to circumstances in other municipalities? Could they be applied in circumstances with neighborhoods that have shelters was another example. And I'm sure all those things could happen. That would require conversations with CGI, and as the delegation noted, they are not the only organization that provides restorative justice approaches. And I think the intent was to spark that conversation amongst us. Consider the conversation sparked, and we will follow up with our community partners at the staff level.
Thank you.
Councillor Foxton.
Thank you, Chair. And just to respond to Councillor McCabe, so we also had a great, and it's a lovely bylaw, but it doesn't have the teeth that the region had. I want the teeth put into it. And so if we can get a consistent bylaw from all 8 stating that bylaw will act upon these, and maybe we can use the justice system to show us how to properly act on it. But I think that actions. What bothered me the night that we passed the bylaw here was that a lot of people stood at that podium and they talked about the situations where they were harassed, and a lot of them were not on regional property. And they didn't realize that or they may not have realized that the bylaw we created was only for regional property. If we want it to have real teeth, we have to mimic the same bylaw consistently across the region to protect everyone. So that's my goal. Thank you.
Okay. Chair Redmond.
Thank you, Chair Urban. I hope that this brings a little bit of focus, at least for me, on this issue, and that is, I guess I'd go back to Graham Walsh and just say, I would be really surprised if we don't have an implementation plan already in existence. So as much as this is a wonderful offer, I would be really interested to know what other groups we're working with currently, and you don't have to give me chapter and verse or us right now, Graham, but just, it would seem to me that this can be added to the mix, but I would understand that plans are already in motion to implement this update on anti-harassment bylaw.
Through you, Mr. Chair. Yes, indeed, and we are fairly far along in our plan, given that the implementation is in about 3 weeks or so. Certainly happy to hear any other perspectives. We do have community partners that we worked with in the development of the training and the implementation of the training. The Coalition of Muslim Women, who were the chief proponents advocating in favor of this bylaw amendment, have been a great partner with us. And we do know that our enforcement staff have regular contact with CJI, and some of these, as I mentioned before, some of the same themes that we were discussing here this morning were incorporated into our training. Happy to share that with the group and work with them. But I can tell you that this, the informational and preventative value of even passing this bylaw was a key topic of discussion, getting this message out into the community and equipping our bylaw staff with the information they would need to conduct those conversations if required.
Councillor Sean, Uniac.
Chair Erb, I am in favor of curbing hate in the region in whatever ways we can, by whatever means we can. However, I'm concerned that the operations of bylaw might be in conflict with operations of restorative justice. I don't know if the former delegation can speak to that, or if there's staff members here who can speak to that, or fellow councillors who can speak to that, but that would be my concern.
Mr. Walsh.
Through you, Mr. Chair. It's a great question, Councillor Kinnick. I can say with confidence, based on the discussions we've had, the training we've given staff, I don't see a conflict between the two at all. I think this is another tool that is now available and another preventative measure available to our bylaw staff and the region as a whole in terms of preventing hate in our premises. I would not say the two are in conflict. There's always an opportunity, as there was before this bylaw was amended, for preventative justice and these types of conversations.
Okay, so just to clarify and make sure that my colleagues and I are understanding correctly, you're saying it can be a both and, not an either or.
Through you, Mr. Chair, I believe what you said is it both and not either or is what you said at the end?
Yes.
Yes, absolutely. I think these two can exist in parallel.
Okay. Does that?
Councillor Deutschman.
Yeah, thank you, Chair Erb. I just want to follow up on what Mr. Walsh was saying. So, yeah, I mean, bylaw is there to, they're going to come across a situation. They're going to investigate. They're going to decide whether they're going to, I guess, ticket or what have you. But ultimately, if they decide to ticket, my understanding would be that there has to be then some way of dealing with that issue. And that's where the restorative justice piece would come in. That's the post. If I have that incorrect, please correct me, Mr. Walsh, but it just seems to me that bylaws determining how to deal with de-escalation or what have you and dealing with these situations. And ultimately, if a ticket is provided, bylaw is not then the judge and jury with respect to that. And that this is where the restorative justice or the CJI piece comes in.
Through you, Mr. Chair. Councillor Deutschman, I think you're correct. I think there's also the opportunity where charges aren't laid. So in many cases, we'll issue a notice of trespass or there will be discussions with bylaw. And I think there's an opportunity there in many cases to facilitate a discussion after the fact, even where charges aren't laid, to have a discussion.
Thank you. So just to recap, you are planning on bringing a motion back, or there's going to be some kind of, pardon me? A notice of motion, okay. And you're responsible for that. That's okay. And if there's going to be any further conversation with area municipalities, that's going to be incorporated into that. Yes. Thank you. Good.
Guys, regional bylaw never comes to North Dumfries. Never. When we had the election signs and everything else, they told our staff to pick them up. Every time there's something to do with the regional bylaw that affects North Dumfries, my bylaw staff have to pick them up or deal with it. So they never come. So it's not consistent across the region. That's what I'm aiming for. Thank you.
Okay. Thank you for this conversation. On to item number 6, the consent agenda. If you want to remove an item from this consent agenda, please indicate so now, as we will take no questions on consent items, and unless items are requested to be removed from the regular agenda. The item listed on the consent agenda be dealt with in one motion. Is there anything that you want removed? So, if I could have a mover and a seconder, moved by Councillor Fox, seconded by Councillor Wolf. Can you use your e-scribe buttons to please vote? Are you in favor, Councillor Craig? It's carried. Okay, thank you. That's carried. On to item number 7 under our regular agenda, equitable services and opportunities. I'm going to call on the Commissioner of Public Health and Paramedic Services, Dr. Wong, to introduce the presentation and the presenters.
Thank you, Chair Erb. So earlier this year, we informed Council of our intention to explore with health system partners an alternative destination model for mental health and addiction services in Waterloo Region. Today, we have 4 presenters from our Community Steering Committee here to talk about the Alternative Destination Clinics, an initiative under the Community Safety and Wellbeing Plan. Next slide, please. These are the presenters. We are excited to share how both local Ontario health teams, service providers, and individuals, caregivers with lived experience have come together on a common desire and goal. I will now turn it over to the speakers, starting with the co-chair of the steering committee, Steve Chasm. Thank you.
Good afternoon, everybody. My name is Steve Chasm. I'm a caregiver with lived experience who is involved in healthcare advocacy at various levels of government, our local hospitals. I also team lead a peer-to-peer parent support group called the Association of Parent Support Groups in Ontario. The KW Cambridge chapter is one of 10 chapters in the province. I'm excited and pleased to be co-chair of the steering committee on this project that's so important to those in our families who struggle with mental health and addiction issues, as well as acquired brain injury issues whose diagnosis was just recently added to our family story. The aim of the alternate destination clinics model is to provide people with access to the services they need, when, where, and how they need them the most. This model looks at new ways to respond to mental health and addiction crisis by providing an alternate destination for individuals in crisis other than hospital emergency departments. In June 2023, a community steering committee was established with over 20 service providers and individuals and caregivers with lived experience. The providers include Community Healthcare in KW, CMHA Waterloo Wellington, Lang's Primary Care, Lutherwood, Porchlight, and Thresholds Homes and Supports. Representatives from both the Cambridge North Dumfries and KW4 Ontario health teams, as well as all 3 hospitals, paramedic, Waterloo Regional Police Services are also on the committee. Interestingly enough, 8 of the steering committee members are community members with caregiver or lived experience. 3 of those members, 3 of those 8, come from the parent support group I mentioned earlier. The collaboration among the steering committee members has been amazing to watch and an important part of this work. As the steering committee moves towards implementation, the goal is to open 2 sites, one in each Ontario Health Team area that would serve all residents in those areas. These sites will provide a safe space for mental health and addiction support with referral pathways both in and out of the clinics. For example, walk-ins, referrals, paramedic service and police transport drop-offs, with referrals to health service providers when they leave the clinic. The Ontario health teams, service providers, and individuals and caregivers with lived experience are working together collaboratively to design the 2 clinics. At this point, I'll turn it over to Lisa Akey.
Good afternoon. I'm here representing Ashna Rahim, who could not be here today. She is the lead of the KW4 Ontario Health Team. I'm here to talk about clinic locations. The Cambridge and North Dumfries Ontario Health Team will lead the Community Mental Health and Addictions Clinic, better known as CMAC, serving the Cambridge and North Dumfries area. Christina's here today and she's the lead of the Cambridge and North Dumfries OHT, and she'll speak more to that site specifically. The Canadian Mental Health Association of Waterloo, Wellington, and Threshold Homes and Supports, as members of the KW4 OHT, will lead the Mental Health and Addictions Integrated Crisis Care Center, serving Kitchener, Waterloo, Wilmot, Wellesley, and Woolwich area. Eric from Threshold's Home will speak more to this site shortly. In the KW4 area, access to mental health and addiction services continues to be a high priority. Our priority neighborhoods represent a significantly disproportionate amount of emergency department visits for mental health and addictions conditions in relation to our actual population size. The KW4 Ontario Health Team is committed to ensuring that the current projects of the Mental Health and Addictions Working Group will align with the strategies and initiatives of the alternative destination clinics. The mental health and addictions issues that span across the entire population and that we're faced with in our region, we're excited to support the region in addressing these issues and conditions. Along with the Cambridge and North Dumfries Ontario Health Team and our partner agencies within the KW4 Ontario Health Team, we look forward to creating a solution for an integrated system of care for our communities.
Good afternoon. The Cambridge North Dumfries Ontario Health Team has mental health and addictions identified as one of our 3 priority populations, and therefore is a significant focus of our efforts as we work towards our vision of seamless and integrated services. An early identified opportunity by the CND OHT was to improve quick access to mental health and addiction services, and to increase the coordination of services to improve the patient, caregiver, and provider experience. When our OHT was offered one-time funding by one of our partners back in December, we jumped at the opportunity to trial our homegrown, innovative approach to addressing this need. The Community Mental Health and Addictions Clinic, or CMAC pilot project, weaved together existing services. It was actually co-staffed by over 6 OHT member organizations and offered a highly supportive, welcoming walk-in clinic model. The CMAC also allowed us to explore alternative paramedic drop-off processes, and both the Cambridge Memorial Hospital Emergency Department and paramedic services were highly engaged. Together, we identified how this clinic could be leveraged as a safe and supportive alternative to the often overcrowded emergency departments. In collaboration with our partners, the CNDOHT implemented a comprehensive data collection plan to understand the impact of the clinic over the course of the 8 weeks, and those evaluation results are publicly available on our website. We know that this clinic had a positive impact on our communities and providers. The data is clear. And even more powerful is the patient experience. Therefore, I will leave you with the words of a patient thank you note to demonstrate the impact of our CMAC pilot. I've been struggling with severe depression and anxiety for over 2 years. I've tried multiple different programs, but everything is a 9-month+ wait. We need something accessible that will be easier. I'm in crisis mode, and it's a 9-month+ wait anywhere else. CMAC has been able to help me this week. We need more programs like CMAC, where they have accessibility to programs and help now.
Thanks, Christina. Nice to see everyone. So I'll be speaking on behalf of Threshold Homes and Supports at CMHA regarding the integrated crisis care model. We're here to reiterate our support for this important project and speak on behalf of sector partners that also see the need for this type of model in the community. We are currently leading, being ourselves as CMHA, the clinical working group, which will look at a design that will effectively deliver these supports. That design will come from a process of community engagement, including those with lived experience, sector partners, primary care, and first responders that will help drive the needs of the community and this model. We acknowledge that this clinical working group will also lead towards a funding request, but that we may always not have the ability to wait for funding to deliver important services. And CMHA and Thresholds are dedicated to allocating resources to make this project happen, even in a pilot form, to help showcase the needs of the work and deliver services within the community. Thanks.
My name is Katie McDonald. I'm the co-chair with Steve of the steering committee as well as a manager in public health. I'm just going to touch on a few next steps and then we're happy to take questions if there are any. So the Cambridge North Dumfries Ontario Health Team, KW4 Ontario Health Team, Threshold Home and Support, Canadian Mental Health Association, Waterloo, Wellington, and the steering committee will work with local providers to confirm locations, develop clinical structures, and determine what existing resources can be reallocated or co-located. Following this process, a funding proposal for additional resources will be submitted to Ontario Health West. We will continue to engage community partners, service providers, people and caregivers with lived experience in area municipalities through the steering committee and other existing networks to move forward with implementation. Thank you for your time, and we're happy to take any questions.
Thank you. Councillor Deutschmann.
Yes, thank you, Chair Erb. Thank you very much for coming in and making that presentation. You know, our community really needs to work harder in the areas of mental health and drug addiction. It seems like there's a real lack and void in the community, and it's not for lack of all the great work you all do on the front lines, but it just seems that we need to do more. And I just want to thank also, I wasn't familiar with Thresholds Homes, so I just looked you up on my Google, and so I can see that you do a lot of extensive work. So my question is, I'm familiar with the program because I had a chance to chat with Sarah Escobar about that program, and there's been some other conversations about how well that program, the mental health program, the 8-week pilot or however long it was. I just had a question because WRPS, or Waterloo Regional Police Services, has a great program going on too, I don't know if it's in beta, we'll say, but it's the Crisis Call Diversion Program, which has had a really high success rate in dealing with mental health emergencies. So I was just wondering, is there coordination with what you do and what they do? Is there I was just curious about that.
Through you, the chair, I'm going to invite Helen up to speak about that program.
Hi, I'm Helen Fishburne, the CEO at CMHA Waterloo Wellington, part of the great partnership that's bringing this program to life here regionally. And great question. Thank you so much, Councillor. The program that you're referring to is called IMPACT, so the Integrated Mobile Police and Crisis Team. And we are embedded with Waterloo Region Police Services right in the detachments. We go out and we respond to 911 calls together to respond to the mental health and addiction crises. So that's kind of the first part of the program historically that we've had for 8 years. We have about a 75 to 80% diversion rate from hospitals. So when we were able to respond to those folks, we're able to divert them from hospital almost 75 to 80% of the time, which is awesome. The second part of the program is the program that you're just referring to, which is the Crisis Call Diversion. That program is actually diverting folks from a police intervention. So when they come in through 911, we actually are able to respond to folks, just the IMPACT team without police. So that's kind of the second phase of the program, again, showing really excellent outcomes and data. Both our IMPACT program and Crisis Call Diversion will be closely linked to this integrated crisis center, which includes the alternate destination pathway that you've just heard about. So we're kind of all one team behind the scenes, bringing some of these existing programs into how the model will work and kind of maximizing what we have on the ground and then building new on top of that. So I hope that's
I just want to say it's good to hear because you'd hate to have all these things working in silos, but it's nice to see that they're integrated, which I guess we would expect a Waterloo Region approach, barn building, barn raising approach to dealing with these very significant issues in our community. So thanks for that explanation. And I appreciate hearing about the interconnectivity between the different organizations. Thank you.
Thank you.
Chair Redmond.
Thank you, Chair Urban. I can't tell you how thrilled I am to see this model coming to Waterloo Region. Many of us, when we were at AMO in London, got to visit their alternative destination. And one of the things that was my takeaway was that there was such a low bar to get in. You did not have to be referred. And I wonder if you just want to speak to how accessible this makes mental health supports.
Through you, the chair. Yeah, we are definitely making sure that there are multiple different options, referral pathways. People can walk in if they don't feel comfortable calling 911, for example. So that's definitely one of the key priorities for us, is to make sure that it's accessible. We also visited London, and that was an important part that we've been having conversations about.
And if I could just make a comment, it's great to see the Ontario Health Team stepping forward. I know they have a very dynamic relationship in London with the hospital, and if somebody goes and they feel they need to be admitted, somebody from that clinic takes them there, and it really frees up medical staff as well as keeps paramedics from sitting in waiting rooms with potential patients. So thank you very much.
Councillor Wolf.
Through you, Mr. Chair, thank you for your presentation and for all the work you're doing. Where are you located?
Through you, the chair, we don't have locations yet. One of our next steps is to identify locations so that we can start to pilot and implement this project.
Okay. And lately I've heard about threshold homes. Where's that located?
I'm going to do this.
Yeah.
There we go. So Threshold Homes and Supports is located in Waterloo Region and Wellington as well. We support over 1,000 individuals across the sector, about 350 in homes at about 14 different locations. Particular to this project, we have existing crisis beds within the Kitchener area that would be ideal in pairing with the integrated clinic in terms of continual support.
Do you have any in Preston?
Any which, sorry?
Do you have any homes in Preston? Do you know?
I'd have to check. It's very
Okay.
possible.
I just was hearing about that. So, okay, thank you.
Thanks.
Councillor McCabe.
Thank you, through you, Chair. Really encouraged to hear this program. As Chair Redmond said, it sounds like it's really obviously greatly needed in our community. I'm just curious about the 911 calls and how they come in. So if I understand what you're saying, so there'll be like whoever the dispatcher is receiving the call will have like tiered questions that they'll be asking in order to divert the call to the appropriate resource. And I see nods. So is that sort of how it will work? Because the other question I have with the 911 is, because sometimes wearing with my mayor's hat on from the city of Waterloo, I mean, we sometimes our fire resources are dispatched as well. So I'm just wondering how that fits in terms of like diverting maybe some of those resources from calls of this nature as well.
Thank you. Good afternoon, Council. I'll try and answer your question because it's multi-layered. I think tiered response and how tiered response looks, whether it's police, fire, paramedics respond, is one step. From a paramedic services lens, if we respond to a patient who has mental health and addictions related issues, and these clinics are up and out running, what we will do is apply to the province for approval to transport to those clinics instead of to the emerge. So it's much more of a downstream solution once the call has already existed. With respect to tiered response and the need for different agencies to respond to a 911 call to begin with, that's a kind of a separate conversation and not really in scope for this work. But certainly, as I mentioned last week, and we continue to work with our fire and police partners on right-sizing our responses to 911 calls, and absolutely mental health and addictions calls are on our radar for that reason. So, you're welcome.
I don't see any other questions. Thanks very much for an informative presentation. It was interesting to remember back when this was first brought to council to see the progress that has been made and the steps that you had. And if I may, I just have one question related to diversion. So one of the 3 or 4 criteria or next steps is a location. So right now when a diversion takes place, where do you go?
Through you, the chair, I'll invite Chief Riches up.
I think that's the actual crux of the problem, if I may, Mr. Chair, and that is that right now there is nowhere else to go for paramedic services and in many cases for police response, although the police have a very successful impact team. The only choice when we respond is either someone refuses care and transport, which has risk and challenges associated for that person with that lived experience, or we take them to an emergency department, which the literature tells us is not the right place for somebody suffering mental health and addictions challenges to be at for all the reasons that we've explained prior to council. So that's the challenges right now. There is nowhere else to go, which is why this work is so critically important, and we established something in Waterloo region in multiple locations.
Good.
Thank you.
Thank you. Thanks for being here. Merry Christmas. That was for information, no action required, but great information. We're on to item number 8, Council Committee tracking, which you received for information. Is there any other business? Our next meeting is January the 16th.
Sorry.
Sorry, Councillor Craig?
Yeah, Mr. Chair, just as a comment, and it refers to the time limit we have for delegations. And I'm not being critical of any of the chairs, but just as an observation, I think most delegations understand they have 5 minutes and tend to go a bit over. And I think we should be more lenient with those delegations, and the chair should sort of interpret the situation and allow people to continue on just to finish up, although trying to respect as much as possible the 5-minute limit. We tend to, because of that arbitrary situation, terminate a lot of people who are just about to finish up. So I'm just leaving it as a point of interest for members of council and the chairs, possibly to be a little bit more, not disrespectful of the bylaw, but more respectful of the of people trying to just finish up when they're trying to say something. Just an observation, Mr.
Point taken. Thank you. Any other business? So our next meeting is January the 16th, 2024. Can we have a mover and a second to adjourn? Moved by Councillor Foxton, seconded by Councillor James. Use your e-scribe to vote. That's carried. And I know everybody will be back in January, but I know you won't forget budget in 2 weeks. Pardon? Next week.